The point of this panel is to think about the future of HIV/AIDS in the Middle East. Professor Noha Forster agreed to moderate this panel, and she's going to give a few remarks and ask some questions and kind of get some conversations going about the things we've heard today, which both involve a lot of kind of technical, statistical ideas and also a lot of anthropological, political, and religious issues. So hopefully we can get some kind of synthesis in this panel. Thank you very much.
Thanks. Okay, well, a quick thanks to everybody who's here and to Sammy for really coming up with this idea quite a while ago and organizing it and asking me to be part of it. Thank you, Sammy, for bringing us to the real world. I mean, it happens sometimes at the University of Chicago in the humanities that we do tread in these extremely important and actually dear to my heart. My first job, if I can just say quickly, was with Catholic Relief Services in Cairo, and it was the one practical year of my life. Since then, I've been totally impractical, and I yearn, actually, after the Arab Spring. A lot of us who live abroad were yearning to get our feet wet in these practical issues. But we'll talk about the Arab Spring in this context, actually. So I'm just going to make some remarks, reflections on what I've heard and what I've read, with an eye to getting you to talk a little bit more about the future. And they're kind of random, they're unorganized, because they came out of my being here and kind of writing notes as you were speaking. So all of the communities we've talked about the three communities of intravenous drug users, female sex workers, and men having sex with men. And obviously, for cultural reasons, these are all vulnerable communities. And as such, they're very much affected by the state's attitudes towards them. I know culture is important, but we've seen so many instances. For example, I'm from Egypt. So many instances in Egypt of, you know, a very blasé attitude as we were watching commercials that you would think Muslims would be shocked by. But I grew up watching all kinds of commercials, very open commercials about condoms. I remember doing field work in a village in Egypt, and just to show a little bit how there's a gap between intention and effect. So the condoms were available in this very remote, very conservative village, but they were available to children to use as balloons. So the children would buy these condoms, blow them up, and play with them in the air. So, I mean, that's what happened after this big campaign, I'm sure very expensive media campaign, to get people to have safe sex and to actually to limit the population. That was also the main reason. So we have to really look at the state. What is the state? Whose state? There are at least 23 countries we were talking about today, and I think one of the main themes that came across was variability. We can't really talk about what's going to work here because we have different populations. In some cases, the problems are kind of spread all over the country. You would need a media campaign addressing the But in some, as we saw in Morocco from Professor Raddad's talk, you know, they're very isolated. So what kind of route do we need if what we're talking about is a problem that's very provincial? We saw in the talk of the Alaï brothers, Professor Kamyar and your brother, a fantastic idea of, a depiction of the details of what works and what doesn't. Sometimes what's needed is the commitment of a group of people, like led by them. They were working with a group of people and came up with some extremely useful for anybody else who's trying to replicate a success story, what works and what doesn't work. So we can think of these things. I mean, they brought up the notion of sometimes you need a global approach or a regional approach, sometimes you need a national approach, and sometimes you need a very discrete, localized regional city approach or village approach. And their approach was in Kerman. There are some helpful points, I think, in what I heard today. It seems to me that the numbers are not huge. Yes, they're growing, but they're still not huge. They're on the low end of things. Also, the studies are there. There are a lot of studies not sufficient, maybe not, especially with regard to the Gulf countries, but there's something to work with there. We have models, as I said, of what works. I think one interesting thing highlighted by the Kerman project is that it's, we often say the challenge is funding. How do we find funding for what we want to do? But they also say funding is necessary, but it's not a sufficient variable. It's not a sufficient condition for what needs to happen. And that especially with these sensitive issues that we're discussing, without the community's understanding of what you're doing, that's not going to be a successful project, no matter how much money you pump into it. As we saw with the balloon condoms. I mean, if people don't understand the connection between this material thing or this new behavior you're pushing, then the money is going to be wasted. Now, so other hopeful things have to do with the cultural environment that we're find ourselves in. I mean, just very casually and undeliberately, in the past 10 or 15 years, I've seen in media, social media, satellite TV shows across the Arab world, and I'm curious to know if this is the same in Turkey or in Iran. Well, no, Iran would be a very maybe special case. An opening up of space to talk about all of these things that were considered sensitive and sometimes taboo. So some of the things I see are even shocking to me, and I live in Chicago. Very open debates about incest, about female sex workers is a very, very big thing. Almost every day, on a daily basis, there's something on TV, interviews, and they cover their faces, or they blur the faces of discussions with female sex workers. Female genital mutilation, all of these things are homosexual sex, transgender, all of these things that were considered marginal are quite ubiquitous in media, including television, satellite television, and across from Lebanon to Egypt in particular, but also in Morocco, in the North African countries as well. The language, I just watched a show the other day, and the broadcaster was making a point of telling her doctor guest, yes, I won't call them shawad jinsiyan, I will call them, and then she said something like, رجل يمارس الجنس مع رجل, which is male sex with a male. Whereas the old terminology was derogatory. How do you say? Shaz jinsiyan, so sexually deviant, I guess. So those are some hopeful things, but obviously it's not all rosy. Also another hopeful thing is with regard to the AIDS epidemic, we see a few celebrity figures, actors, former beauty queens, and so on, espousing the cause of AIDS awareness and trying to remove the stigma. So big names are involved in this, and I think one of them is like a UN ambassador for AIDS in the Arab world, Minna Shalabi, actress. And everybody, I think, a few of the panelists today mentioned the film about Asma, so kind of humanizing the face of AIDS, that it's a person with a whole life, and in the midst of all of these positive things, there continue obviously to be culturally negative vestiges of, a culturally restrictive. So, for example, doctors I think we mentioned earlier, doctors not wanting to examine patients who have AIDS, for even if they have a kidney issue, they've come for some other medical issue, so they just die not because of AIDS, but because of some other simpler issue. A doctor on television was discussing recently how in medical school, they still treat AIDS as if it's a foreign issue. It has nothing to do with their society, that they're unlikely to encounter when they're talking about it to their students, that is. Some health workers tell AIDS patients that they need not tell the doctor about their AIDS so as to get care for whatever other ailment they came in for. So the Arab Spring also kind of foregrounded for very many different reasons. I mean, anybody who was in, for example, Midan al-Tahrir came out with this impression that there were a lot of gay activists, so much so that the more conservative activists said, oh, all of these liberal activists are gay. I mean, they would just say, oh, they're all gays, and they would, I remember there was a ubiquitous image on YouTube of a man holding a condom and saying, look what we found in the tents. They're all engaging in illicit sex. So there was this kind of meshed with all of the political tensions between conservatives, liberals, people all coming together in a small space. And one of the weapons that they would use was the sex weapon, like, oh, this is a den of iniquity. Now, the importance of the state, whether it's before, and I'm not saying that the loosening up of the stigma, the opening up of space to discuss these issues is a result of the Arab Spring. It predates it. The Arab Spring kind of just came later. But what are we going to do with these big issues that require government intervention? What kind of states are we ending up with? I mean, the nature of the states is not, we don't know what kind of state we will have in Egypt. We don't know what kind of state, if any, we will have in Iraq or in Syria. So there are large chunks of the geographic area, and for that matter, Iran. I mean, what direction is Iran taking exactly vis-a-vis these issues? So the state has a lot to do. As I said, it's not just culture. It kind of leads culture. It doesn't just follow culture. So, for example, in Egypt, under Morsi, who was overthrown in the summer, because the state took a hands-off policy vis-a-vis protecting its marginalized communities, for example, the Shiite community. The Shia community is this very tiny community, but that led to a very bloody interaction in a small village outside Cairo. So what role the state plays is a life or death issue for these communities. If you're going to allow a discourse, whether in written or oral media, that marginalizes these people, makes them feel impure or not part of the society, this has repercussions for what happens on the ground. So I think the role of the state is going to be very important. It always has been very important, but it's just that we don't know exactly what many of these new states. I was very intrigued to hear about Morocco being kind of a model for openness and transparency. Since actually the revolution has taken a kind of downward turn in Egypt, gay life has come under quite a bit of attack. And human rights groups, some of them protect, and some of them are kind of don't want to be involved with it. They're finally trying to acknowledge that the gays did play a role in the revolution, make a space for them. But the Egyptian Initiative for Personal Rights is one of the groups that does acknowledge the rights of the gays, but then there are lots of human rights groups that are still behind the time. Let's see. Yeah, actually, it's very interesting to see the evolution of public AIDS messages about AIDS, rather than treating it as a disease like any other, and mounting public health, campaigns like they did with polio, for example, or tetanus. they had very primitive kinds of ads in the beginning, in the 80s and 90s. They had very primitive ads with bats and strange figures that just say this is a disease resulting from evil behaviors and foreign, also including the foreign dimension. But now, as I said, we've come a long way since then. Yeah, so the question then rises, like, when you who are experts in, I mean, some of you have come at it from a very, how do we measure AIDS growth, the growth of AIDS epidemics? How do we measure them? What are the cultural, variables that we have to take into account to understand what kinds of interventions are going to work? What works and what doesn't work in the field? All of these things. I mean, do you think are you hopeful? I mean, I didn't come out of this conference with a sense of despair, or that this is considering all of the other problems that we have in the Middle East, other health problems, I mean, problems in general, including other public health problems. I mean, I see this as a kind of discrete and manageable one. And in fact, maybe after, I mean, this is just kind of a speculation, maybe after the kind of the experiments with Islamic regime in one of the largest countries of the area and the demise of that regime, there may be a space open for a more clinical approach, a less kind of culturally heavy and not constructive approach to these issues. So maybe a space has opened for that kind of discourse. I certainly see it in, vis-a-vis a lot of other social problems. So people are now saying, no, that's an Islamist approach to this. Let's take a scientific approach. I mean, that's just what people say. I'm not saying that there's a necessary contradiction between an Islamist and a rational approach, but that's what people say. So I don't know. Maybe it's a hopeful period. For many reasons, that being just one of them. So,
I'll start with Ali because he's leaving early.
تفضل.
Thank you for opening the discussion about this. So what? We know that HIV is coming. We know affected groups. So what kind of program is going to be implemented in the field? What is the next step of reaching this population and getting them to services? Basically, I would say it's very demanding, and regarding the Iran as a kind of, I know about this. They are open to talk and discuss about what we're going to do, what is the best thing to do, and how we're going to implement the kind of 5-6 general interventions to prevent or getting better effect out of this. The problem is, mostly we don't know from where we could start. So we need a kind of roadmap, applicable, trustable at the top level, and very detailed protocol in the field that could be monitoring from top to down. What is implemented in the field is in line with the objectives we had as kind of strategy. Now we are implementing the 6th strategic plan against HIV in Iran. And when you go to the strategy, it's fine, but the problem in the field is the tools to implement is not ready. For some of the reason, it's a kind of budget cut happens through the sanctions, some global funds that could be reached to the country at the time, but didn't. The other problem may be, I think, so much need from different parts. If you go with this HIV, what happened to the other disease? So Again, a kind of prioritization happened in the field. I mean, it could be a kind of, it could be improved in terms of getting community involved to make the decision for their own. It's a kind of partnership building between those who are affected, those who are belong to this, get them to this kind of decision making, to make their own choice. I mean, it's their decision. You can provide these things, those things, but they should do something themselves. It's not always you should care about them,
Right.
but it's themselves and their community should care about this. So in another way, I'm saying it's not the responsibility of Minister of Health to get all those people to the services, but it should be understood from the people to be tested, to get tested, to know about their risk, to follow this. But anyway, I'm not saying the Minister of Health or any other government should not provide the positive environment, effective links. I'm not saying that. But some part of this, I mean, it depends on the people, how to understand the community, how they're active.
Yeah.
So it's a kind of complex issue when we talk about the community, how to get people involved in this, understand. Maybe it started from the education, but it's not enough at all. I mean, more training to the people, changing, but it takes time. But I mean, we cannot leave it on the government side, but we should go to the community.
And is there space in Iran at all for initiatives from the UN to involve themselves in community level initiatives?
I mean,
like
these are,
Kerman?
according to what I know, so many NGOs are working in the field. So many are funded by UN agencies, the other from local, or they are from the community. But what I'm saying is not sufficient at all.
Okay.
More peers should be involved, more in the studies, in the services, more decision making should be happen in the field for their own. So otherwise, you just implement something that not being usable, or they didn't use it. It is available, and these are the steps maybe we should care about to get as much as possible from the ongoing services in the field. I mean, in all the cities, there is a center for female sex workers established by the university who has the authorization for that community in Iran. And there are some few semi-private services for the female sex worker. But according to the number of female sex workers for that community that we expect, only 50 female sex workers per month accessible get services from them. What is the problem? Is the services are free of charge. I mean, nobody stigmatizes them from. There is no label on the service. Okay, people are trained, peers are there, but it's the community that the people still afraid, still not. There is a problem. There is a barrier to get to the services, or to be tested, or when tested positive to receive bite results. And this is the cascade. We lose so many opportunities when we talk about at risk to the people who get into the services and being treated sufficiently. According to the numbers, 1 out of 5 is diagnosed. Again, 1 out of 5 who diagnosed who are eligible reaching to the, getting to the services. And those who are getting to the service, as you see, 1 out of 3 is just lost 6 months after the first visit in a capital. So this kind of losing opportunities is, for me, is a kind of most important things that could be done to get people to the service, to get people know about the HIV status, and to make their own decision about their current and future for their own and those who are living with.
I mean, are there models of what's worked in other places? I mean, it seems that when you have a cultural barrier that seems insurmountable, the only way to surmount it is that I've seen work kind of in these very local contexts is to have somebody really important that they respect, whoever that may be. It could be a religious person or some rich landlord or something who's on board with you. You know, those kinds of.
That is, I mean, that is happening in case we have a kind of specific book targeting the religious reader in Iran. The book is in Farsi, in Persian language, and it's just for religious reader to know about the HIV, how to speak to the community when they're talking about other things.
Yeah.
And there are specific leaders trained by UN agencies and the Ministry of Health to talk to other religious leaders to be involved in this. What I'm saying is, it's not just by training this. It's not just by providing the book. It's not just by providing this training package to send it to the Ministry of Education to be provided in the school. Something should be happening by another way of thinking. And I mean, it takes, a kind of time to be. But now we are very open to talk about the epidemic. We are very open to talk about this marginalized group. So many people who are very conservative now appreciate this kind of risk behavior happening. And who want to be a sex worker in a context of Islamic country, who always you can't live with you can't go to school, you can't take your children to any places. That's tough.
It's very isolating.
It's very isolated. So why are you putting you in a situation? This is because they are very prone to. It's not their problem because they want to be.
No,
it's So all of these things, people now understand. The policymakers, high policymakers, appreciate this, and the environment and the space is open to go beyond that and to implement something which is sometimes happen in some countries, some regions, but it should be scaled up anyway. I think, again, it takes some time, but everyone, should play his role to get it in the place.
Yeah. Any comments?
So, Ali raised a very important point that we have to look at the target population, and we have to not only inform them but also involve and engage them from the beginning of need assessments, situational analysis, designing, implementation, and evaluation. So I want to just give you a couple of examples. In Afghanistan, for example, in Afghanistan, 90% of women in rural area, they know about the maternal mortality, family planning, but only 10% they use family planning. This is due to social barriers, religious barriers. So it's not just educating them, as Ali mentions. And the other example is that USA, they spend huge amount of money to bring clean water inside home for Afghans. So 1 year later, when they got back to do evaluation, they saw that most of the Afghans, they destroyed all of the facilities that they provided. So when they asked them, why did you destroy this that we spent millions of dollars? Women said that because we didn't have clean water inside our home, so we had to spend 1 hour or 2 hours to get clean water, to bring it at home. But this gave us opportunity to chat with other women. So we did social activities. But when you brought water inside home, so we don't have any excuse. So it's very important that we have to look at our target population. What is their need? And based on their needs, we have to develop our approaches. And it's very important when we look at the international law, as you mentioned, we have to look at the local norms and practices. Based on international human rights law, we have to respect countries' beliefs. So we cannot, even, for example, there was a case in France that they arrested a person who was practicing for, circumcision for women for 5 years in sentence, but they have to be trained before they get sentenced. So this is a lot of debates that we cannot just give one law applicable to all different countries. And at the same time, when we talk about the Muslim countries, there are 54 countries. They are Muslim, but they have different ethnicities. They have different cultures. So we cannot say all Muslims do this or not. If you look at 20 years ago, in Iran, we started family planning, because after revolution, the head of country said we need to have more people. That was the population increased from 30 millions to 65 millions within 10 years, more than 4%. So that was, we had a lot of experts, they started and negotiated with religious leaders. Now we have almost 1.1%. So it was very successful. But the point is that instead of blaming, the religion or culture, we have to work with them. Why? Because even in some of the scientific materials, for example, even about, for example, treatment of HIV/AIDS, there are a lot of controversy between doctors. How do you expect a religious leaders that had no idea about HIV should know everything? It needs time. So for example, when we wanted to start our program for 5 years, as we showed in 1995 until 1999, there was a fighting between Ministry of Health and prison organization in Iran. Because Ministry of Health said all of the HIV, they get HIV inside prison, and the prison system said no, they get from outside. They were fighting. But when we started our program, even prison was the target. We didn't start from inside prison. We started from the outside, and we showed the model, but one of the members of the provincial committee was head of the prison system. And that was, he was informed, and after 1 year, he said how we can help. And when we wanted to ask them to help, we didn't say to have needle exchange inside prison. We said, if you provide education, if you provide bleach, that's enough. And little by little, we expanded the program. So I think we shouldn't be very rushed. We have to respect the culture, and we have to involve religious leaders. And that was the successfulness of our program, for family planning, for HIV/AIDS. Because, always there are some sentences, they are very conservative, even about abortion in the US, there are a lot of conservative. But there are other sentences. So that was by highlighting, for example, when Ali said about the vulnerable women, that was, I remember in 2000, when they asked us, religious leaders, are you working with sex workers? We said we are working with vulnerable women. So that was very critical, because sometimes some words have a lot of meanings. You have to be careful which words you use. It's like a diplomat, Diplomat, you cannot say whatever you just think. So it's very important by rephrasing the words and approaching and respecting the religion. And for example, when we had some training, we asked some of the religious leaders to be in our training, and they said, don't use this sentence, use this sentence, and by this, so we learn from them. It's two ways. It's not just we say we know everything, they know nothing. Right. So I think it's very important beyond the epidemiological aspects to think about health policy and the implementation with respect of law. And there are a lot of good law and regulation in Iran and other countries, but the problem is that they don't know how they can implement it. That we have to involve the community. And I think it's a lack of a lot of countries in the Middle East, we didn't have a kind of experience of working together as a team. We always had a leader, one leader monopoly. So how you expect us to be advanced in HIV/AIDS? If you look at any non-governmental organization activities, there are a lot of weaknesses. So that was in the Global Fund, we put in that proposal that 20% should be implemented by non-governmental organization. Because we thought at the end of 5 years, non-governmental organizations should be involved. But it's two ways, is the rights and responsibilities. So when the people have the right to have access to services, they have the responsibilities to implement those services as well.
Right.
Thank you.
Thank you. تفضل.
Yeah, so I think in relation to actually governments, first of all, I think the Arab world, or generally the Middle East, has a real problem in terms of governance, which is not only in relation to HIV, in relation to everything. And this is why we had actually an Arab Spring. Clearly, the populations are not very happy about their governments. The failure is not only in HIV. The failure actually extends much beyond that. Now, however, speaking about government, just based on experience of working with them, the first issue is that many governments don't see actually the urgency for doing anything about HIV, or doing very little. When I moved actually to Qatar, one of the first things I did is actually I went to the ministry, met the vice minister, told him, okay, why don't we do this and this and this, the classic things, for HIV. And the guy is actually very cooperative, very open, but he told me, well, let me tell you, there are 83 HIV-infected persons in the whole country. The number of new diagnoses every year is actually decreasing in Qatar. And right now, we are talking about 6 to 7 cases per year being diagnosed. Almost the whole population has been tested for HIV in Qatar. We have actually over 500,000 HIV tests every year in a population of 2 million. Wow. This is how, because every immigrant actually has to be tested, premaritals have to be tested, pregnant women have to be tested, blood donors, of course, get tested, etc. They don't see HIV. They really don't see it. So he is very cooperative, he's very open-minded, but he just does not see any urgency to do anything more. The new diagnoses are actually quite often related to exogenous exposures. People go outside and actually get the infection inside. It does not appear we have actually a local epidemic within Qatar. So this is the reality. How can we convince such a actually policymaker to make a decision about this if he actually does not see any urgency? Yeah. Now, of course, this is not the case for all countries. For other countries, they do have actually the urgency. And to their credit, they actually changed. Iran is a very good example, but of course, a lot of it thanks to actually the activism. Iran changed completely their approach just when they saw actually the urgency of the situation. Now, another issue is actually priority. HIV is still relatively a small problem. If we take a country like Egypt, where 15% of the adult population are actually infected with hepatitis C. What is actually the prudent thing to do? To focus on hepatitis C, where there is a lot of needs to be done, where 15% are infected, or to go with HIV, where actually 2 in every 1,000 are actually infected. So clearly the priorities, is not for HIV. So this is actually another issue. A fourth issue is governments are actually very sensitive about public perception. No government actually would like to admit that they are working with men who have sex with men, or even injecting drug users, or even sex workers, because it's too politically risky. They prefer to do things in a very discreet way. And for other sectors of actually the community, for example, NGOs, they really don't like that. For many of them, they want, no, I want actually this issue to be national front, because also many NGOs have other interests. For example, MSM groups, they would like actually to make homosexuality legal. They would like to everyone to be out of the closet, etc. Government just simply cannot do that, because they are very, very worried about hostile reaction from actually the population. They prefer to do things in a very discreet way, but they are actually open to do things in a discreet way, which I think is quite interesting. So some countries actually developed quite creative ways to actually dealing with these issues. Actually, governments helped NGOs to work with these groups. They funded them, they provided them for capacity to do HIV testing. They opened even VCTs, voluntary counseling testing services, within this NGO organization, just to do actually this. In fact, we now even call them GONGOs, government-organized, non-governmental organizations, which is actually very ironic, but it's actually working, So it's which I think actually might be an effective model to do this, to avoid this sensitivity. So, and also, of course, we should not really forget, governments are very, very different in the region. I mean, of course, generally the failure is more widespread, but also to different degrees, and different governments behave differently. Saudi Arabia is a very close, country. Morocco is a very open country. They are actually very different and likely to behave differently.
So I would say I'm generally optimistic. I mean, when you talk to activists or when you look at the work that organizations are doing, I think it's really inspiring, and I think it's being really effective. It's funny that you started your talk with the state and the question of its role, and that's the one thing I'm concerned about, especially in terms of maybe it's not so much the state, but their ability to control security forces and cultural baggage or discriminatory actions that security forces take against certain people. So, you look back and, in distant memory, the Cairo boat incident in Egypt, and, you wonder, or you have to wonder, what's the state going to look like, and, with shifting political parties, and are they going to start using the internet as a way of entrapping people again? Like, what are going to be the kind of violations on the horizon? And at least right now, what none of us can say, but I'm concerned, especially with cybersecurity in general. So, the good news is that the civil society actors that are out there are really, truly great. But I do question the role that the state's going to play in relation to it. So I know that it doesn't have a lot to do with HIV necessarily, but it's just the concern I'll put out there.
Yeah, one really distressing thing is that there's an environment, and I'm sorry if I keep coming back to Egypt, but it's the place I know most, but there's an environment now where it's not even just the state that's kind of threatening, but the word NGO, the word activist, many words are now, by the population, not by the state, are considered condemnatory by definition. So, بتوع NGOs, النشطاء دول, and people on Facebook are making fun of those people. This is a very distressing turn of events, beyond the state. It's like we're used to having tyrannical states, but when the population becomes tyrannical, that's
interesting. Yeah,
very frightening. Yeah.
I mean, I know that we've worked with some activists in the past that are concerned about even receiving certain emails because the PDFs that they may get from an invitation to a meeting may be evidence in court in and of itself to prosecute them. So, I mean, that's one of the things that I'm particularly concerned about, because I was just really surprised to see that being, on the radar, let's say.
So I just add one sentence to emphasize again. It's if you want to motivate the, policymakers, the point is that how do you raise the issue? When you see the government is very conservative, if you start with talking about sex workers, LGBTIs, so what do you expect them? Because it's not just a single person to decide. They have a group who are very extremes. They have religious leaders who are, maybe very conservative. So that was when we approached them. The first thing we said we want to save the life of the baby whose mother has HIV. So who can say no? So when we got the opportunity to talk, to have center, to implement services, then we said we want to save the life of the mother of this baby. So who can say no? And said we want to provide prevention of mother-to-child transmission, little by little, phase by phase. They get familiar and they get, their response. And instead of highlighting the negative aspects of the government about HIV, we say, if you do this, you can show that in the next 5-10 years, you can protect and control HIV/AIDS. If you don't do it in the next 10 years, you get a lot of HIV, and that's have negative impact on your reputation. So, and then when we approach the mother, we said, this baby has father as well. So when we approach mother, it's not fair to approach father of that baby, but it's happened to be a drug user. So, I said, it's doable, but we have to be, patient when we approach them. And when we approach them and when we put ourselves in the shoes that there are a lot of pressure, it's not about us. And we just show them, it's not, when there are some activism that they are very extreme against the government, we said, if you do this, they can stop all the program.
Right.
So this is the issue is different from, activism in the US or activism in that, countries that the infrastructure is completely different. So we cannot, make them very democratic. It is, overnight. So that's we have to be, careful. That's, this we learn, for example, in a medical school, they train us that when the patient comes with the pain here, don't touch that place first. Touch other places, and at the end point go there. So by this way, patient will be, more, tolerated, comfortable, and then little by little you get the target. So that's, I think, if some, intervention are not successful because they are very not patient,
Right.
and they are not very, thinkful about the strategy. So that's we call our strategy as a river strategy. In the nature, there is no river which goes straight. It change its ways, but the more it goes, gets stronger. So we have to be like river, and when we get some, conflicts here, we have to pass smoothly, and that's the reason even we got released after 2 years in prison. So we didn't directly blame the government. We said let's work to continue. So because we are more outcome oriented, that's output oriented. The outcome is the clinics are there, and since we didn't put the clinic after our name, even they arrested us, they couldn't close hundreds of clinics. And now you see the second generation, Ali is working and others are working. That's the deal, that mentality.
Right. Right.
If I could ask a question, it's really interesting to hear you guys speak about approaching the HIV pandemic in the Middle East in this way, kind of a slower, patient pace, especially when you kind of compare it to the history of HIV in the United States. Because when you look back to the 80s and the 90s, it's hard for a lot of us in this room to think about it because we actually kind of just missed being politically conscious during that time. But some of you might remember this in that actually nothing was being done, nothing that got done with HIV in the United States got done without intense activism and intense organization from a grassroots level, and not by professionals. I mean, professionals were certainly involved, but by the people who are suffering this disease and who are part of the communities in this disease. It got to a point where in the early 90s, during the first George Bush presidency, there were activists throwing the ashes of their loved ones who died from the HIV pandemic onto the White House lawn. It took Ronald Reagan about, I think the first time he mentioned HIV in a public speech, 30,000 Americans died of HIV. So I'm interested in, because one of the reasons I wanted to organize this conference is to maybe introduce this idea to people outside of the who specifically work on the issue, because it really, I think it's something that requires some urgency, some sense of urgency. So how do you balance that? How do you balance the urgency where we have the potential to stop what happened in the United States and what's happened in sub-Saharan Africa and the Middle East from happening, with the patience that you're saying is necessary for kind of introducing the kinds of systems needed to deal with the disease?
So the point is that if you look at our presentation when we started at end of 1999, it took us 2 to 3 years to get government involved. But when the government got involved, we shared the credits of activities with the government. For example, I remember before we started our program, the head of the university, he didn't care about HIV/AIDS. But when we developed the program, so they gave us a space of storage of 2 meters to 3 meters. But the head of the health commission said, if you did something that the people oppose you, we don't support you. If you got something good, so we share. So that's fine, Then when the work was well, and it was presented to the WHO, so the WHO wanted to come to visit our activities. So that was Ministry of Health was involved. So he wanted to come one day before to see what we can do. So when the representative of WHO came, and they wanted to thank us, we said we did nothing. The Ministry of Health did this. So through positive reinforcement, when you do this, so then they will be, this is their work, not your work. So they will support it. And that was our clinic from 1999 to 2002 increased to 3. From 2003 to 2005 became 100. So it depends of when you put it in the right direction. It's like a river. So you want to swim if you swim against the river, it's very, difficult. But if you go, but through their power, manage and cross the, river, you can be successful. This is our message. I definitely agree that that was urgent, and that was I started with showing the high rate of suicide. But I said the strategy is different. So the goal is that I have a strong voice and just be in the TV, say I am activism, and every other day government arrest me. Or I want to motivate the government to do the same thing that I want them to do, and they just repeat my words. That was how we did. For example, when we went to International Harm Reduction Conference in 2002, so we were in opening of that conference, and in the audience we invited the head of the health and care of the prison system. So in my last sentence, I said, I am so happy that the director of the health and care of the prison organization is here, and I think he wants to do something good. So everybody did this, and then I said, no, they are expecting you to do something. Little by little, based on my belief, the governments are like childs. So how do you treat children? Don't touch, this electricity is fire. So when you have this kind of expectation, little by little, you can motivate them. So this is, I believe on this. I got the results, and it's doable. But we have to think: what is the outcome? Do you want to say this is my work, or do you want to say this work is continuing and doing progress? So that was. After the government changed, the new governments wanted to remove our names from all the documents, even from the best practice. They removed our name from the acknowledgement, but they forgot to remove our picture. Our picture is there, but our name is there. That's fine. So this is the message I want to share with you, that when we want to think about is HIV is not just a disease, it's cultural, economical, political issues. So when we can overcome the barriers, it can be, the application can be anything, from the health to new, social movement, to whatever you think. That's we call it as a medical diplomacy. So that's we have to see how it could be, successful in one scale, and how we can adapt it, adjust it based on different cultures and religions. This is the same for Christians. Some of them are conservative. This is the same for Jewish, or for God knows Buddhism. So this is the lesson we have to learn, and that's I said, to be patient, to be diplomatic. Thank you.
It's okay with you guys. I think we'll end it on that note because we've pretty much reached the time. Thank you all so much for presenting, and thank you, Noha, for moderating this discussion, and thank you for everyone who came here. I really enjoyed this. I hope you enjoyed it as much as I did and learned some new things. Thank you.